This conference is being recorded. Cette conférence est enregistrée.
Hello everyone, bonjour à tous. Welcome and thank you for participating in today's update on COVID-19 in Canada. Bienvenue à la mise à jour au sujet de la COVID-19 au Canada. Today we'll hear remarks from Canada's Chief and Deputy Chief Public Health Officers, Dr. Theresa Tam and Howard Njoo. They will be accompanied by Health Canada's Chief Medical Advisor, Dr. Supriya Sharma. The doctors will be available for questions after their remarks. Nous entendrons aujourd'hui des allocutions de l'administratrice et du sous-administrateur en chef de la santé publique du Canada, les Dr. Theresa Tam et Howard Njoo. Ils seront accompagnés de la conseillère médicale en chef de Santé Canada, la Dr. Supriya Sharma. Les docteurs seront disponibles pour des questions après leurs allocutions. If you wish to ask questions, please press star 1 on your phone. Si vous désirez poser une question, appuyez sur étoile 1. Let's begin today's briefing. Over to you, Dr. Tam.
Bonjour à toutes et à tous. COVID-19 disease activity is continuing to decline nationally and in most jurisdictions. Over the past week, an average of under 2,350 new cases reported daily across Canada, and severe each day, with under 650 in intensive care units, and 37 deaths were reported daily over the past 7 days. With nearly 30 million Canadians having received at least one dose of COVID-19 vaccines over the past 10 months, evidence continues to show that being fully vaccinated provides good protection against COVID-19 infection and excellent and enduring protection against severe illness, including due to the highly contagious Delta variant. The National Advisory Committee on Immunization, or NACI's latest review of vaccine effectiveness data finds that while COVID-19 vaccines in use in Canada continue to be very effective in protecting most people against serious illness due to COVID-19, emerging evidence suggests vaccine effectiveness against infection may decrease over time in some situations. At this time, NACI is recommending a booster dose for some populations at highest risk of severe illness and waning protection following a primary series. Specifically, NACI has expanded their late September recommendation that adults in long-term care or other congregate care settings should be offered a booster dose of an mRNA COVID-19 vaccine to now include seniors 80 years of age or older as well. Additionally, NACI recommends that some other key populations who may be at increased risk of severe illness or increased risk of lower protection over time and who are essential for maintaining health system capacity may be offered a booster dose of an mRNA COVID-19 vaccine at least 6 months after completing their primary series. These populations include adults aged 70 to 79 years, people who received 2 doses of the AstraZeneca Vaxzevria or 1 dose of the Janssen COVID-19 vaccine, adults in or from First Nations, Inuit, and Métis communities where infection can have disproportionate consequences, adults who are frontline healthcare workers who have direct in-person contact with patients and for whom the interval between doses of their primary COVID-19 vaccine series was less than 28 days. NACI continues to closely monitor vaccine effectiveness across the population and will update their advice as needed to ensure the best protection possible for all Canadians. Importantly, with over 5.5 million eligible adults and youth not yet fully vaccinated in Canada, it is important to emphasize that getting more people to complete their 2-dose primary series remains a key focus of the immunization effort in Canada. This is even more important as we head into the respiratory infection season. Getting fully vaccinated against COVID-19 and up to date with other recommended vaccines, including the annual flu shot, is an important foundation of protection. Building on this by wearing face masks, keeping up with hand and cough hygiene practices, getting the best ventilation possible in indoor spaces, and staying home and away from others if we develop symptoms are important additional layers that can help us keep healthy while reducing virus spread to protect others and the health system through the winter. Last week, we also mentioned applying these practices to plan safer social events, starting with Halloween this Sunday. I look forward to seeing how our great Canadian creativity rises to the challenge of having celebrations that are fun and safer for everyone. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. L'activité liée à la COVID-19 continue de diminuer au pays et dans la plupart des provinces et territoires. Au cours de la dernière semaine, moins de 2350 nouveaux cas ont été signalés en moyenne chaque jour au Canada. Et les tendances relatives aux cas graves sont stables. En moyenne, 2100 personnes atteintes de la COVID-19 étaient traitées dans nos hôpitaux chaque jour, dont moins de 650 dans les unités de soins intensifs et 37 décès ont été signalés quotidiennement au cours des 7 derniers jours. Près de 30 millions de Canadiens ont reçu au moins une dose de vaccin contre la COVID-19 dans les 10 derniers mois. Et les données probantes continuent de montrer que la pleine vaccination offre une bonne protection contre l'infection à la COVID-19 et une excellente protection durable contre les formes graves de la maladie, y compris celles attribuables au variant Delta, qui est très contagieux. Le plus récent examen des données sur l'efficacité des vaccins réalisé par le Comité consultatif national de l'immunisation, ou CCNI, révèle que, même si les vaccins contre la COVID-19 utilisés au Canada continuent d'être très efficaces pour protéger la plupart des gens contre les formes graves de la maladie, de nouvelles données probantes semblent indiquer que l'efficacité des vaccins contre l'infection pourrait diminuer au fil du temps dans certaines situations. Pour le moment, le CCNI recommande l'administration d'une dose de rappel chez certaines populations les plus exposées au risque de maladies graves et à la perte de protection après leur série primaire de vaccins. Plus précisément, le CCNI a élargi la recommandation qu'il avait formulée à la fin de septembre, à savoir que les adultes vivant en établissement de soins de longue durée ou dans d'autres milieux de vie collective devraient se voir offrir une dose de rappel d'un vaccin à ARNM contre la COVID-19, afin d'y inclure les personnes âgées, 80 ans ou plus. En outre, le CCNI recommande que certaines autres populations clés qui pourraient être exposées à un risque accru de maladies graves ou à un risque accru d'une diminution de la protection vaccinale au fil du temps et qui sont essentielles au maintien de la capacité du système de santé puissent se voir offrir une dose de rappel d'un vaccin à ARNM contre la COVID-19 à un intervalle d'au moins 6 mois après la fin de leur série primaire de vaccins. Ces populations sont les suivantes. Les adultes âgés de 70 à 79 ans, les personnes qui ont reçu 2 doses de vaccin, Vaxzevria d'AstraZeneca ou une dose de vaccin de Janssen contre la COVID-19, les adultes originaires des collectivités inuits, métis et des Premières Nations ou qui s'y trouvent où l'infection peut avoir des conséquences disproportionnées et les adultes qui sont des travailleurs de la santé de première ligne qui sont en contact direct avec les patients et dont l'intervalle entre les doses de la série primaire de vaccins contre la COVID-19 était inférieur à 28 jours. Le CCNI continue de surveiller de près l'efficacité des vaccins dans la population et mettre à jour ses conseils aux besoins pour offrir à l'ensemble des Canadiens la meilleure protection possible contre la maladie. Surtout, comme plus de 5,5 millions d'adultes et de jeunes admissibles ne sont pas encore entièrement vaccinés au Canada, il importe de souligner que le fait d'inciter plus de gens à compléter leur série primaire de 2 doses demeure un objectif clé des efforts de vaccination contre la COVID-19 au Canada. Cela est d'autant plus important à l'approche de la saison des infections respiratoires. Une vaccination complète contre la COVID-19 et la mise à jour des autres vaccins recommandés notamment le vaccin annuel contre la grippe, constitue une base importante de protection. Dans cette optique, le port de masque, le respect des règles d'hygiène des mains et de l'étiquette respiratoire, l'optimisation de la ventilation des espaces intérieurs et le fait de rester à la maison et à l'écart des autres si nous présentons des symptômes sont autant de mesures supplémentaires importantes qui peuvent nous aider à rester en bonne santé tout en réduisant la propagation du virus afin de protéger les gens et le système de santé tout au long de l'hiver. La semaine dernière, nous avons également mentionné l'application de pratiques pour planifier des activités sociales en toute sécurité. En commençant par la fête d'Halloween ce dimanche, j'ai hâte de voir comment nous mettre notre grande créativité canadienne à profit pour relever le défi d'organiser des célébrations amusantes et plus sûres pour tous. Merci. Thank you. Miigwech.
Thank you, doctors. We will now open the phone line to questions. As usual, we ask that you limit yourself to one question and only one follow-up. We'll be taking questions in both official languages. Donc, nous allons prendre les questions. Nous vous demandons de vous limiter à une question et une question de suivi. Vous pouvez poser vos questions dans l'une des deux langues officielles. Operator, first question. Opérateur, première question.
Thank you. Merci. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, Annie Bergeron-Olivier, CTV National News. Your line is open. À vous la parole.
Hi, thank you very much for taking our questions. Right now, you're considered fully vaccinated if you've completed a full series of a vaccine, and that's a requirement to enter Canada, enter many workplaces and businesses. As more and more groups are being told to get a third shot, do you foresee that becoming the new definition of fully vaccinated? And how is Health Canada preparing to deal with cases where people have 2 versus 3 shots?
Dr. Tam, I think you're on mute.
Thank you. Thank you for the questions. So right now, having had a full primary series of vaccination is considered fully vaccinated. We are not currently considering the need for the additional shot or booster for the definition of fully vaccinated for the purposes of federal requirements at this time. But of course, we will keep reviewing the evidence and requirements from now. For international travel, for instance, we have to consider the fact that many countries don't even have enough vaccine to complete the primary series. So we have to balance both the scientific facts, the recommendations of our committees, but also the reality of the vaccine supply and equity from a global perspective as well. I am having continuous discussions with my colleagues, the other chief medical officers, in reviewing what the definition of fully vaccinated as we're going along. But right now, we don't expect any changes at the moment for the federal populations that we are looking at. And certainly, I think the provinces are thinking about it. But I think given that really this third dose is to strengthen the protection for the for those who may have reduced protection over time, it's going to be a bit different for different populations. And I think the primary focus maybe for the provinces will be to make sure those high-risk populations and high-risk settings are protected. And that's within their jurisdiction in terms of the policies that they will set. But for now, for the federal government, we are not looking at any changes at this time.
Okay, great, thank you. And my follow-up is, right now travelers entering Canada need to get a PCR test before arrival. Those are often expensive and very difficult to find. In the United States, rapid antigen tests are being used and accepted for travel. Is Canada considering using rapid antigen tests, especially as more people travel and border restrictions loosen? And what is the difference between using that antigen test versus the PCR requirement that we currently have?
Yes, thank you for that question. It is very much a live issue in terms of discussing not only within the federal family, but with the provinces and territories. As some people may have noticed, we're continuously learning about both the vaccines and their performance, as well as the behavior of the virus, particularly of a highly contagious virus like the Delta variant. So right now, I think the pre-departure test is an important layer of protection to reduce the risk for importations into Canada. No layer of protection is ever 100% perfect. We know that. But recognizing that while vaccines reduce the risk of protecting people against infection is not 100%, and that protection could wane or be reduced over time. So for now, we haven't shifted that policy, but we're reviewing that on an ongoing basis, especially during a period of time where Canada is still, in many areas, battling the fourth wave. We are continuously adapting our vaccine policies, including the need for boosters. Of course, as everyone knows, we're reviewing the submissions for the pediatric vaccinations, and we're heading into winter. So with all of these considerations, I think having that additional layer of protection is deemed important at this time, but we will review it. So the difference between the PCR and the rapid antigen test. The PCR test, of course, is more sensitive in terms of detection, particularly when you're talking about asymptomatic travelers coming across the border and detecting the virus. The PCR test is fundamentally more effective at detecting the virus in asymptomatic or mildly symptomatic people. As well, I think there's an operational consideration of standardization in other countries. So we have a much better idea about how PCR tests may be performing in another country. Rapid antigen tests are very varied in their abilities to detect the virus. So if we were to implement a option for rapid antigen tests, for which there are many, Health Canada, even in Canada, has approved many that can have different performances, verification of that test that's been done in another jurisdiction is something that has to be worked through. And it will be very difficult, particularly as you can imagine, rapid tests can be conducted in all sorts of settings, from a pharmacy to some other setup in another country. And so it's not an easy piece to work through. So for now, we have kept the PCR testing requirements for the pre-departure test.
Thank you, Doctor. For our next question,
Thank you. Merci. Our next question, Eric Plouffe, Radio-Canada. Your line is open. À vous la parole.
Bonjour. J'aimerais avoir des précisions sur la recommandation d'une dose de rappel pour ceux qui ont reçu le vaccin d'AstraZeneca. Est-ce que c'est possible de savoir pourquoi c'est le cas là, pour ce vaccin-là?
Okay, merci pour la question. C'est Dr. Njoo. Le Comité consultatif national de l'immunisation continue toujours de considérer, analyser les données probantes. Et ce qu'on a vu aussi avec les études, je pense à travers le monde, que la durabilité de la protection des personnes qui ont reçu les 2 doses de vaccin d'AstraZeneca est peut-être pas si haut, si durable que les personnes qui ont reçu un vaccin RNM. Donc, c'est pour cette raison, le CCNI recommande maintenant que les personnes qui ont reçu des 2 doses de vaccin d'AstraZeneca, on peut leur offrir une 3e dose d'un vaccin RNM pour une dose de rappel pour augmenter la protection.
D'accord, merci. Et en Colombie-Britannique, ce sont, si je ne me trompe pas, tous les adultes là, ou les gens âgés de 12 ans et plus qui pourront recevoir une troisième dose à partir de la mi-janvier 2022. Pourquoi est-ce que le CCNI ne fait pas une telle recommandation?
Le CCNI est actuellement est en train de considérer toute une gamme des enjeux et aussi des questions comme ça pour recommander les doses de rappel on voit aujourd'hui certaines populations à haut risque et c'est possible, je ne sais pas parce que moi je ne fais pas partie de ce comité. Peut-être au futur, bientôt, on peut avoir une autre recommandation pour la population générale, mais à date, on continue à souligner le fait que une série primaire des vaccins donne une bonne protection à la population générale, particulièrement contre les formes graves de la maladie. Et ce que la Colombie-Britannique a annoncé, c'est vraiment au futur. Je pense que c'est peut-être que pour 2022. Et je pense que entre maintenant et 2022, je pense qu'il y a aussi beaucoup des choses qui peuvent évoluer. Et je pense que le CCNI est en train aussi de regarder, analyser des données probantes. Et peut-être on peut attendre des autres recommandations entre maintenant et le début de 2022.
D'accord, merci.
Merci, docteur. Prochaine question.
Merci. Thank you. Our next question. La prochaine question, Laura Osman, the Canadian Press. Your line is open. À vous la parole.
Thank you. I wanted to ask again in English about a potential for a booster for everyone. I know you spoke about how vaccine availability globally needs to be considered as well. Some provinces are already moving toward boosters for the entire population. What is your message to them right now?
Yeah, thank you for the question. So, as Dr. Njoo has said in French, right now the vaccines are performing really well. We have Canadian data, and thank you for the provinces, British Columbia, Quebec, Ontario, providing us with ongoing data on vaccine effectiveness in Canada. And remember that Canada is different to the United States. We had a different vaccine interval for the most part for different populations. And we know that that increased interval actually offers a higher quality and duration of protection. So all of this has to be taken into account. Right now, the vaccines are still performing really well against severe outcomes and for the most of the population. And so while there may be some reduction in protection against any infection or milder infection. So this information is being tracked over time. At this point in time, there is no evidence of any widespread waning of protection against severe disease in the general population who's been vaccinated against COVID-19. So boosters for the general population are not required at this time. But NACI and the agency and the provinces will monitor this vaccine effectiveness over time because we have the ability to track this through the studies, the surveillance for vaccine effectiveness that's been put in place. And so I would see this as a phased approach to the recommendations, just as we've had a phased approach in the initial vaccine rollout. NACI will take another look at this over time. But what I think there's commonality is that the general population who are healthy, for example, don't really need another dose this in the near future. And we will come back and provide further recommendations in due course.
Thank you. Follow-up?
Thanks, Dr. Tam. I also had a question for Dr. Sharma about the pediatric vaccine. The FDA had their advisory committee this week. They voted in favor of it. I was wondering if that's something that Health Canada was monitoring and taking into account when making its own decision about the Pfizer vaccine for kids 5 to 11.
Thanks for the question. So absolutely, we had members of Health Canada present for the entire committee meeting, all 8 hours of it. And those deliberations and the discussions will be inputs into our review as well. Obviously, Health Canada, we do our own review looking at the Canadian context and all of the data. We did get the data a bit later than the United States as well. So, you know, our scientists are in the process of looking at not only the results from the clinical trials and the studies that were done, but also the details on the new formulation. But absolutely, we're working not only with the US FDA, sitting in and on their committee meetings, but also other regulators that have a similar submission under review, and we're sharing information and expertise as we do for all of our COVID-19 submissions.
Thank you, Doctor. Operator, next question. Prochaine question.
Thank you. Merci. La prochaine question, Olivier Ferron-Boas, TVA. Your line is open. À vous la parole.
Oui, merci. La question est pour Dr. Njoo. Je veux revenir sur une question qui a été posée plus tôt à Dr. Tam concernant la 3e dose. On parle d'une recommandation du CCMI pour l'instant, mais est-ce qu'il y a un moment où vous voyez où ces groupes-là qui n'ont pas reçu de 3e dose, qui n'obtiennent pas de 3e dose, ne seraient considérés comme étant pas adéquatement ou pas complètement vaccinés dans les prochains mois?
Merci pour la question. C'est Dr. Njoo. Comme Dr. Tam aussi a constaté en anglais, pour le moment, à l'heure actuelle, la série primaire de 2 doses donne une excellente bonne protection pour la population générale. Et on continue à suivre, comme dit, les études de l'efficacité des vaccins, la durabilité de protection, parce qu'il y a plusieurs études qui sont en train de se dérouler, même ici au Canada et aussi à travers le monde. Donc, pour l'instant, je pense que ce n'est pas nécessaire de donner une 3e dose à la population générale. On voit aujourd'hui que le CCNI a fait des recommandations pour certaines populations à haut risque et on a déjà constaté c'est quelles les populations. Mais pour la population en général, ce n'est pas le moment. C'est quelque chose à suivre. À un moment donné, si on a assez, comme dit, des données probantes qui indiquent peut-être qu'en général, il y a un impact sur la population avec les maladies, les formes graves d'infection de la COVID-19, c'est quelque chose à suivre. Mais c'est aussi une question, comme Dr. Tam a constaté, que ici au Canada, on est chanceux. On a assez de doses de vaccins pour donner à tout le monde la série primaire de 2 doses des vaccins. Et il y a plusieurs régions partout dans le monde qui ne sont pas capables maintenant d'offrir à leur propre population les 2 doses des vaccins comme ici au Canada. Donc, je pense pour l'instant, il faut toujours suivre la science, les données probantes et pour l'instant, oui, comme on dit, une série primaire de 2 doses d'un vaccin à RNM, même aussi le calendrier des doses mixtes donne une excellente protection en général pour la population et ce n'est pas nécessaire de donner une 3e dose.
Merci.
D'accord, merci. Oui. J'aimerais simplement vous entendre sur demain, là, la vaccination va devenir obligatoire dans les transports. On pense aux trains, aux avions, aux croisières au Canada. Je veux simplement savoir, selon vous, quel genre de différence ça va avoir sur le type de propagation qu'il peut y avoir dans ces lieux, dans un contexte où il y a des personnes qui ne sont pas vaccinées et là, dorénavant, elles le seront tous. Quel genre de différence, selon vous, ça peut avoir dans un contexte de propagation de la COVID-19?
Merci pour la question. Ce que je peux vous dire, on sait avec la science et les données probantes à date qu'il y a toujours un risque élevé pour la propagation du virus dans, comme on dit, les espaces clos, aussi avec, comme on dit, où la ventilation n'est pas très bonne. Et aussi, si les personnes sont, comme on dit, dans une situation achalandée. Donc, je pense que pour les moyens de transport, on peut voir que dans un avion, dans un train, c'est un environnement où il y a plusieurs personnes ensemble et dans un espace clos et ils sont ensemble pour peut-être que quelques heures, mais peut-être même plus longtemps que ça. Et c'est pourquoi c'est très important comme une autre couche de protection pour la sécurité et aussi protéger la santé de tous les passagers sur les moyens de transport, d'avoir les personnes entièrement vaccinées comme un objectif de santé publique. C'est toujours, c'est fait partie de notre grand objectif d'avoir une couverture vaccinale, j'espère 100%, mais comme un composant, je pense que c'est très important aussi d'exiger les passagers sur les moyens de transport d'être entièrement vaccinés.
Merci, docteur. Rapport à la prochaine question.
Thank you. Merci. Our next question, Jamie Marasher, Global News. Your line is open. À vous la parole.
Hi there. Can you guys hear me okay?
Yes.
Yes, we can.
I just have two questions for you. I wanted to move back to for just a moment. I'm just wondering, I know at the last press conference you had said that we're likely going to see that approval soon, that it's moving through the system. If we have a better idea of a date, or even, are we talking about mid-November still? I know, given that we're likely going to see that FDA approval come out either today or Monday, people are wondering here what the timeline looks like, I guess.
So I don't know if other people are having the same difficulties, Jamie. I'm assuming you're asking about the pediatric vaccine, but you cut in and out a little bit. Can you just confirm that that's the one that you're asking about for a timeline?
Yes, I am. Can you hear me a little bit better?
Yeah, no, and actually, you can hear you okay. It cut out right when you said what the submission was that you were asking about. So,
Okay.
I think I don't have a crystal ball. I think, we've talked about the reviews and that they are guided by science and evidence, and we need to really be sure that we're taking the time to go through all of that. Having said all of that, we understand that it's important for provinces and territories to have, an idea of timelines, as well as we have parents and guardians and caregivers that are anxious to know the results of that. So, I think we're still at least a few weeks away from a final decision in terms of, we've received some additional information just this past week that we're looking through. And so, one of the things that we're really careful about is that we know that when we're making decisions, especially about our most vulnerable, precious commodity, our children, is that people want to make sure that we have confidence in the review and the submission, and that we have that information available so people can weigh those risks and benefits. So, in terms of the review, I think it's going very well. I can't see a decision before sort of mid to the end of November, I think, at the earliest. Certainly, it depends on the data and us going back and forth. One of the other things, I'll just do a little plug on the public health side. One vaccine that we have authorized for children is the influenza vaccine. Certainly, we're heading into flu season, and we know that those vaccines are starting to become available in pharmacies and doctors' offices. So, this is a good opportunity to have children vaccinated against influenza as we go through the review for COVID-19, and it's a good idea, if possible, to space those out. So certainly, we know that children are more vulnerable to influenza and getting quite sick from that disease, and we may have had a bit of an influenza holiday last year because we did not have as much circulating vaccine because of the public health measures and the other things that were put into place. So my suggestion would be to get your flu vaccine done soon, and certainly the Health Canada review will be ongoing. As soon as we have a result, we'll be communicating with everybody on that, but it's looking, again, sort of mid to the end of November as an estimate.
Thanks, Dr. Sharma. Just to follow up quickly, you mentioned that you got some new info, some new data. Are you able to talk a little bit about what?
Yeah, so it was actually some of the data that Pfizer had also talked about publicly, where they did the comparison in the two groups of illnesses that were counted in people that had children that had vaccines and children that did not have vaccines. So it was that analysis, and basically, it was the 16 in the one group that did not have the vaccine that had COVID-19 illness, and there were 3 in the group that were vaccinated, and the calculation then was around a 90% efficacy against disease. And again, that's in very small numbers, but that was the data that was submitted to us recently.
Thank you. Operator, next question.
Thank you. Merci. Once again, please press star one if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. Our next question, Christine Birac, CBC News. Please go ahead. Your line is open. À vous la parole.
Thanks for taking our questions. Dr. Tam, you stated pretty clearly that that the evidence to date shows vaccines offer lasting protection against severe illness and death. We're not really seeing immunity waning in the general population, but that there's lower effectiveness in those over 80. In NACI's recommendations today, why then are those under 80 also up for a booster, or recommendations that they may also get a booster?
Yes, so the strongest evidence and the recommendation is for the seniors 80 years of age or older, or those in long-term care, other congregate living settings. But the data also show that the vaccine may be offered because there's some evidence of reduction in protection in the next age group, the 70 to 79 years of age. So that is a trend, and in which case the committee weighed the benefits versus the risk in this population as well, and indicated that it may be at an increased risk of severe illness, and that they could be offered the vaccine. So that's a very key age group in terms of for the provinces for their vaccine program implementation considerations. But there are other ones. For example, adults in or from First Nations, Inuit, and Métis communities. If through a process of decision-making with the community leaders and public health locally, these communities may be offered a vaccine because there's some social circumstances such as crowded living and other contexts in that community, which may put them at increased risk of transmission or exposure. And also there's a logistical element as well, in that as winter approaches, sometimes it's really important to consider providing vaccines to some of these populations ahead of things becoming difficult in terms of getting vaccines to communities. So you may see the territories, for example, enacting other policies right now to protect their populations. And so then the other considerations the committee looked at was actual evidence that the viral vector vaccines, such as the AstraZeneca Vaxzevria and the Janssen vaccine, had lower vaccine efficacy to start off with, and lower effectiveness against infection compared to the mRNA vaccines over time, and that these vaccine recipients may be susceptible to infection sooner. So one of the parameters they looked at is the level of antibodies and how that shifts over time. And so they made that recommendation to offer the vaccine for those who received a primary series of those vaccines. And then, as I've said, that although the general population doesn't need a booster shot at this point in time, some of the frontline healthcare workers who are in direct patient contact may be at increased risk of exposure, but they also may be at risk of transmission in those high-risk settings. And some of these frontline health workers received these vaccines right at the beginning of our vaccine program because they were prioritized and they had a shorter vaccine interval. And now we know that a longer vaccine interval can provide better protection. So that's another group that the provinces will be looking at. But I think, again, NACI makes the recommendations, and the provinces and territories will look at their own particular context, the epidemiology, and the populations that they serve, which even inside the same province could be a little bit different in terms of their needs. So operationally, they'll be taking all those things into account as they roll out their programs. But just to reemphasize that for the general population, there is agreement that they don't need the vaccine in any short, immediate future.
Dr. Tam, just as a follow-up, are you concerned at all that this is a slippery slope, though? You know, as you mentioned, it is up to the provinces what NACI is offering or recommendations, but we're already seeing discussion around general population. Does it seem like it's happening, that is being talked about too soon?
Well, I think it's always good to think ahead. But again, as I said, there is agreement amongst chief medical officers that it's not yet, and that is likely not needed until the new year. But again, I think the data will speak for itself. We will look very carefully, very regularly at the vaccine effectiveness information to make that proposal. Some provinces may be doing it so that they can plan ahead simply because of the program planning requirements.
Thank you, Doctor. Operator, next question.
There are no further questions registered at this time.
Thank you very much. That'll be all for today's press conference. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Bonne journée.
Thank you. Merci. The conference has now ended. La conférence est maintenant terminée. Please disconnect your lines at this time. Veuillez s'il vous plaît raccrocher votre ligne. Thank you for your participation.